the link, which will be posted in the chat to get your hour for the session. Also, you have to pass with a minimum of 70% for your hours to be counted. And without any further ado, I would like to present Dr. Kornmehl whenever you're ready for your presentation.
Okay, great. Hi, it's nice to meet you guys virtually. So I'll just get started. Oh, that's interesting. Hold on, give me one sec. All right, the journey to medicine. So just what kind of made me go into medicine? My mother was my original medicine role model. She's a physician, and I used to go into the hospital with her for emergencies. So I definitely got some young firsthand training and kind of what a physician's life is like early on. Throughout high school, I volunteered in a hospital and I enjoyed that. Throughout college, I conducted melanoma research, and in my gap years between undergrad and med school, I served as an EMT. What was your undergraduate background? So I actually went to this small liberal arts school in New Jersey, Monmouth University. It was great because they gave me a really good scholarship and I graduated with no debt, which, you know, I highly recommend to anyone if you could get a scholarship for college. It's always helpful. And I guess you guys are probably already in college, so I don't know how helpful it is for you at this point, but it is something I'd encourage people to look into. I majored in public health, really just because it was something I found interesting. Some people think because you're going to apply to med school, you have to major in bio or chem or like one of the sciences, and that's absolutely not the case. You can major in whatever makes you happy, whatever you're interested in, and as long as you take the requisite sciences, you'll be good to go. Something I did in college that I thought was really beneficial is, and I'm sorry, I know things are kind of complicated with COVID and I don't know what it's like right now, but hopefully by the time you guys finish college, things will get back to normal somewhat and you'll be on college campuses if you're not already. So I actually regularly frequented my professor's office hours, and this was really helpful because it enabled us to build rapport. And my professors knew me really well. Like they didn't just see me as like another pupil in their class, like they knew me as a person. And then when it came time for them to have to write letters of recommendation for me, it was so easy for them to do. Where did I go to medical school? So I went to Drexel University College of Medicine. This is located in Philadelphia, Pennsylvania. So, you know, obviously I know the struggle of applying to med school and you're just like praying to get into somewhere and that would make you happy. And I totally get that. The only thing, I guess, if you're in a position where you have like more than one acceptance and you have some options, what you could look into is try to consider what you're thinking of in terms of residency. And it's okay if you have no idea. But for me, I really knew I wanted to do dermatology. I did the melanoma research throughout college. It was something I was really interested in. So I wanted to be in an undergrad that had a residency program in dermatology, because it's very helpful to have a home program of whatever residency specialty you're looking into. If you're looking into like more of a subspecialized field like ophthalmology, radonc, orthopedics, whatever. It's always helpful for your home institution to have a residency. So I felt very fortunate to have gotten accepted to Drexel, which had dermatology residency. Where did you do your research gap year? So obviously it's not mandatory to do a research gap year. No one's forcing you to do it. It's becoming more prevalent if you're applying to kind of like the subspecialties I mentioned that are more competitive. So what you could do is you could take off for a year between your second and third year, or third and fourth year. I did between my third and fourth year, which I think is more ideal. And in that time, I had a dedicated research year. And just to give you some idea, I literally cold emailed dermatology researchers throughout the country with a copy of my curriculum vitae, which is kind of like a resume, and just reached out and said, hey, you know, I previously wrote a case report in dermatology because I wrote a case report in college, but I really would love to actually have an immersive clinical research experience, and I would love to work in your lab or whatnot. And pretty much through that, I ended up actually finding my dermatology mentor, my research mentor. And I would probably not be here today, and I would not have matched into residency without that. So don't be shy about reaching out to people when the time comes. Okay. Yeah, so dermatology is a super competitive field. Like most people who apply have 9 or more publications. So you really need to have the research. And I found it hard to do throughout med school because you're studying really hard and you're just trying to do well in your classes. And then when you're not on the classes, you're on the wards and you're just trying to do well there. So having a dedicated research year was beneficial. Where did you go for residency? So I'm currently in residency. I am what we call a PGY3, which means postgraduate year 3. So I'm in my 3rd of 4 years of residency. For dermatology, you do 1 year of either internal medicine or 1 year of surgery, or 1 year of what's known as a transitional year, which is kind of a mix of like surgery, medicine, and maybe like peds and a few other things. And then you have 3 years of dermatology training. So I only have 1 year left after this. Okay, so how do you become a dermatologist? So dermatology requires you to have usually your bachelor's, because in order to get into med school, you usually need some sort of bachelor's. And then once you have completed your 4 years in med school, or in my case, it kind of got stretched out to 5 years just because I did that research gap year. Then you do 1 year of internship, which I kind of said before, could either be internal medicine year, surgery year, or kind of a mix of a few things, called a transitional year. And then you have 3 years of dermatology residency thereafter. And then thereafter, you know, if you want to specialize in one of the dermatology specialties, you could always subspecialize and do a fellowship. And a fellowship could be 1 to 2 years. So what is a dermatologist? So it's a physician who specializes in conditions involving the skin, nails, and hair. We could identify and treat more than 3,000 skin conditions. These conditions include eczema, psoriasis, skin cancer, but there's so many more. We treat people of all ages. Like literally, I get paged to see neonates in the NICU, spanning to geriatric patients who have literally like past 100 who are coming in for skin cancer surgery. So dermatology encompasses different elements. It encompasses pathology, which is like looking under a microscope. I'll kind of go into that. Surgery, pediatric dermatology, and medical dermatology. So pathology. So a dermatologist has to understand the microscopic infrastructure of the skin, and you have to be able to identify what's normal and what's abnormal. And trust me, I think pathology is actually the hardest part of dermatology, in my opinion. It's definitely challenging. You have to get really just practice and practice and practice looking at slides to get attuned to it. So this is me here on my pathology rotation, just looking at slide after slide after slide after slide. Dermatology also encompasses surgery. So we excise both benign and malignant lesions. So I'll have patients who I cut cysts out of, I'll have patients who I cut skin cancers out of. So a lot of people don't realize that dermatology encompasses surgery, but it's definitely a huge part of dermatology. Pediatric dermatology. So we have to know different genetic diseases that predispose to certain skin manifestations. Something like in the picture in the middle, this is showing cafe au lait marks, these dark brown, or I should say these hyperpigmented brown macules, would call it that. So what that has implications for the patient, for their life and for their genetics and when they want to reproduce and whatnot. So we have to be able to recognize, oh, this patient has X number of cafe au lait macules. This could mean this patient needs X, Y, and Z additional workup. And that responsibility to recognize that is on us. On the right, this is a kiddo with a hemangioma, an infantile hemangioma. So we use systemic agents sometimes to treat that. So, you know, we're not just giving creams, we're giving babies systemic agents to help them too. And this on the left is super common. This is molluscum contagiosum, very common in little kids, very prevalent. It's caused by the pox virus, and it's just really hard to treat. Parents don't love hearing that. We have a lot of different modalities, but none is great. Okay. Medical dermatology. So with medical dermatology, we're diagnosing and using topical and systemic medications to treat and manage different skin diseases. So on the left, this is showing a patient with psoriasis, and I just showed a sample of one of the biologic agents we use to treat psoriasis called Cosentyx. And then on the right, this is showing really bad hand eczema. And for that, we use Dupixent. Dupixent is the best we've got to treat eczema. So we're treating patients with systemic agents that suppress their immune systems, and we have to get labs on them. We have to monitor them to see how they're doing. So it's definitely more than skin deep. So a day in dermatology. So dermatology is super fast paced. You're seeing a different patient every 15 minutes. And in that time, not only are you seeing the patient, doing a whole skin exam, trying to evaluate their skin, you also try in between patients to get as much of your notes done as possible, and you also want to send in their meds. So it's definitely super busy, and you definitely have to be good at being efficient. A private practice dermatologist could see more than 50 patients in a day easily. Like some private practice dermatologists literally have a different patient every 5 minutes, and they're seeing some people are seeing 70 plus, maybe even 100 patients a day, depending on what they can manage. So it's definitely a super fast-paced field. Other responsibilities. So in between seeing patients in clinic, I'm trying to call patients back with their pathology and lab results. So letting them know, hey, we checked your labs, you could continue the medication, you're doing well. Sometimes patients just call with questions, and you want to make sure you answer them also, that they know what's going on, that's your role. You also have to deal with insurance denials of medication. So I think Dupixent is the best thing ever, and I want my patient to be on that from the get-go. But the insurance company doesn't want to pay for it. So then I have to go and give them something that actually could have more systemic toxicity, like methotrexate, which is another systemic agent that we use, because the insurance company doesn't want to approve it. But before that, maybe I'll try to email the insurance company some letters saying, listing different research studies indicating why Dupixent is a better option for this patient. Or you'll call them and talk to the pharmacist at the insurance agency. So it just gets, it definitely is more than just seeing patients. There's all the behind the scenes work as well. So just some cases to give you an idea of what we see in a typical day. So MJ is a male in your office with a sore on his upper arm that has not healed over the course of the past 4 months. It appears to be slowly growing and intermittently bleeds. MJ worked in landscaping for 20 plus years, but he didn't really sun protect. So here I'm seeing what I would describe as an erythematous papule that's somewhat eroded. So on physical exam, okay, erythematous plaque, either way, it's fine. Workup. So in this case, I would definitely biopsy it. A non-healing wound, a non-healing new kind of thing that's bleeding is always something that I'm going to be concerned about and think warrants a biopsy. So I do a shave biopsy in the office. I send it to pathology to see if it comes back as a skin cancer. Diagnosis. So it is a basal cell carcinoma, which is a type of skin cancer, and the treatment is excision. So basal cell carcinoma is the most common type of skin cancer in the United States. Approximately 2 million Americans are diagnosed every year with a basal cell carcinoma. Patients with fair skin, patients with a lot of sun exposure, they're the ones most susceptible. Okay, case 2. HL is a 4-month-old female with a rash on her face that comes and goes for the past 3 months. Mom bathes the patient 2 times per week with lavender soap. Doesn't really moisturize the patient much. The patient has a brother with asthma, and the mom has seasonal allergies. Physical exam. So these are some erythematous patches with scale of the bilateral cheeks. And workup, so this is actually a clinical diagnosis. We often ask about asthma, eczema, or seasonal allergies in the patient or immediate family, and anyone would suspect eczema because you have something called the atopic triad, in which asthma, eczema, and seasonal allergies are all part of it. So if someone has asthma, they're more likely to have eczema and they're more likely to have seasonal allergies. Someone has seasonal allergies and more likely to have asthma and eczema. So you kind of get the gist. So we always ask about it as a clinical diagnosis. I mean, once you get attuned to it, you can recognize it immediately. So diagnosis, atopic dermatitis, also known as eczema. Treatment, so typically we would do hydrocortisone, 2.5% cream, which is one example of a low potency steroid that we often use. Because on the face and in babies, we are more inclined to use low potency steroids because steroids have side effects, like they could thin the skin, for example, if they're higher potency. So we also will counsel the mom on the importance of gentle skincare with fragrance-free products. We actually encourage frequent bathing, which some people are surprised by, but you actually, if someone has eczema, you want to trap that moisture in the skin. So we'll recommend you bathe the baby with a gentle skin product like Cetaphil, for example, and then you'll pat them dry and just moisturize very frequently. With babies, we recommend moisturization with a cream or an ointment with every diaper change. People are often surprised why we don't love lotions, but lotions just don't give enough hydration to the skin. Okay, so eczema is an inflammatory skin disease with environmental influences. It affects approximately 20 to 30% of children, 2 to 10% of adults. Infants are often affected on their cheeks and the extensor portion of the extremities. Treatment depends on the age of the patient and the severity of the disease. So case 3. So JJ is a 15-year-old male with pimples on his face that he finds painful and cosmetically bothersome. He notes scar development. He tried over-the-counter products without improvement. So I would consider this pretty severe, moderate to severe, especially if he's noting scarring. That's always a warning sign for us, but I'll get into it a little more. So in physical exam, he has comedones and nodular cysts of his face with atrophic scarring. So comedones are like blackheads and whiteheads. And then nodular cysts are like, if you ever have those painful kind of cysts that are like red and develop under the skin and haven't like erupted, those are nodular cysts. And atrophic scarring is like any indented scarring in the skin. So workup, so it's acne is a clinical diagnosis. Diagnosis is acne. Treatment. So as I was saying before, there's so many things we do for acne. Well, ideally, if someone isn't super severe, we could just manage them with topicals. But as it gets worse, or if it's inflammatory, we'll be more inclined to go to other things. And once they're at the point they're developing severe scarring, we're already like, okay, Accutane is the way to go, which is also known as isotretinoin. And in order to like start people on Accutane, there's a whole process, which I really don't want to get into here, but there's it's very government regulated because it could cause harm to any developing fetus if a woman is pregnant and takes it. So it's very highly government regulated. But what we would do is we'd obtain baseline blood work before starting the medication and then usually repeat again in 2 months. And then if the patient is still on the medication 6 months later, we'd consider repeating blood work at that time. So, okay, now on to the thing that you guys are probably most interested in, advice. So one thing I really want to highlight to people is don't let a humble background make you feel like you're any less capable of achieving your dreams. Like if you, regardless of where you come from, you could make it happen. You absolutely could. It's really all about you strategizing for yourself and trying to take the best route to make yourself the best applicant possible. In my case, I am the only alumnus in the history of my all-girls high school to ever become a physician. No one else did. And that's okay. And I didn't go to an Ivy League college. Most of you guys may not have even heard of my college. I didn't go to a well-known state school either. I went somewhere where I just had a good scholarship to save myself some money, so I made it happen, and it was all about just making the right choices and strategizing. So another thing I want to point out is the road to medicine isn't always linear. It's okay and very common to take gap years. I would say most of the people in my med school class, I think the approximate like average age was around 24, 25. So, you know, just because you graduate from college, it doesn't mean you have to go to med school the next year. It's okay to have a gap year. It's okay to study for the MCAT and take time off. Whatever you need to do to make yourself the best applicant possible, nothing wrong with that. Some people have had prior careers. One of my co-residents, she was, I think, an accountant and a therapist before she even went to med school. So don't get discouraged and thinking everyone has this linear route. I think most people have kind of different routes, and that's what makes people interesting, and that's what med schools actually are cool with seeing and like to see. Advice. So I'd always keep an updated curriculum vitae, which I said is kind of like a resume. So it lists like all your accomplishments, all your honors, all your education previously. Because that way, if you want to ever email someone to reach out for research or clinical opportunities, you could always say, you could always attach a copy of your CV. So then they could just get an idea of what your accomplishments were up to that point. Don't be afraid to cold email researchers if you want to work with them. The worst that happens is they don't respond. But in the case they do, you lost nothing. What's someone going to say? Oh my God, this person reached out to me and wanted to do research with me. Could you imagine? No, people are like, oh, that's cool that they want to reach out to me. I'm just super busy and I really just don't have time and my lab's already full. But no one will be mad or upset that you reached out to them. So take that chance, reach out, like I was in New Jersey, so I reached out to the Cancer Institute of New Jersey and asked to get research with them. So don't be shy, just reach out. You never know. Okay. Also, if you have like any doctors that you yourself go to or talk to them. Be like, hey, have you had any cool cases that you want written up that you think would make a good case report? Because that's how I got my case report. I literally asked my dermatologist if he had any cool cases that I could write up. And that's how I got a dermatology publication in college. So just ask, you'll never lose out by asking. There's nothing wrong with asking. You just seem like a motivated person. Yeah, so if you manage to like publish anything in college, like major kudos to you. It'll only help you later on because, as I said, like applying to dermatology, for example, most applicants have already had 9 research publications. So if you could get some publications under your belt earlier on, it'll just make your life easier later. Okay, so other good clinical opportunities are scribing. I didn't scribe, but honestly, in hindsight, I think it's a great thing to do. And I just didn't know it was an option even. Like I wasn't familiar with it, but I definitely would look into it if you're looking for like part-time jobs that also look good for clinical experience. Scribing is a good one, especially like in the ED. So I'd encourage people to do that. EMT is great too. You really get to work with patients, you get hands-on exposure. Working as a medical assistant is also good. You're working with patients, you're getting medical exposure. These are all things medical schools like to see, that you've had hands-on patient exposure. So they don't want to just see you saying, I worked in a research lab. Well, then you could be like a PhD and work in a lab. You don't have to be an MD. So being an MD usually entails working with patients in some capacity. So they want to see that you have those patient skills and you kind of know what you're getting yourself into, because honestly, medicine is a really hard field. Okay, advice for pre-meds. So I would say schedule realistic course loads for yourselves. Like I definitely knew pre-meds who like gave themselves ridiculous course loads and then just like ended up failing out of pre-med and were like no longer pre-med or whatever. Like, don't do that. Like, if you don't think you could balance a part-time job with research, 6 hard science courses, don't create your schedule that way. Try to tailor your schedule to whatever gives you the best edge to succeed. Like your goal, first and foremost, you're in college. Your goal is to get good grades, to learn and get good grades. That is your goal in college. And then beyond that, you obviously want to get the research and try to get clinical experiences and be a well-rounded person. But if you don't have the grades, you can't even get into the door a lot of the time. So you really need that basis. I'd say get to know your professors as well as possible. Go to their office hours. I know I mentioned this before, but I'll just reiterate it. If it's a possibility in COVID, definitely do I'd also talk to as many different students who already took the courses you intend to take. Inquire what professors are good teachers and fair graders, what resources they use to study, what their study strategies were. Success leaves clues. So you don't have to go into anything blind. I used Rate My Professor a lot. It was helpful for some things, for sure. I don't know, like, obviously I graduated from like undergrad, like maybe close to a decade ago. So it might have changed. Maybe you guys have different resources now, but definitely talk to other students, try to get an idea of like what professors are good teachers and fair teachers, because there's no reason to put yourself through the misery of having a professor who's not a fair grader. I graduated from college with a 3.98, and my only B plus was an English teacher who had not great ratings on Rate My Professor, and I just took that class because I had to take it to I had to take an English class to graduate. Just worked better with my schedule. But honestly, like, you know, for getting 1 B plus, it's okay. My life's not changing, obviously. I still made it here. But that could, if that accumulates, that could totally affect your GPA. So definitely try to take the fair professors. Take the professors who are good graders, who aren't looking to, because they could totally just like be like, oh, well, I just didn't like your comma placement here. I didn't like this. I didn't like that. They have full autonomy to choose exactly what grade they want for you, full autonomy. So you have to make yourself the best you can, put yourself in the best position you can to get the best grades you can, ultimately. Advice for pre-meds. So the MCAT was the hardest exam I ever took. And from what I'm told, it's only gotten harder, and I'm sorry. It sucks. And I've taken board exams. I've taken hundreds of exams by now. I obviously have to take med school exams all the time, but the MCAT was definitely the hardest. So honestly, if you take that and you manage to do well enough, like, major kudos to you, because it was really hard. So what I would do is I'd strategize early on about like what good MCAT study resources are. Try to make a plan for yourself when you tend to take the exam. As I kind of said before, everything's about strategy in life. You have to strategize. How can I strategize to make myself the most successful I possibly can? How can I strategize to get the best grades I can? How can I strategize to get research? How can I strategize to get clinical experience? How can I strategize to do as well in the MCAT as I possibly can? I think I used to go on Student Doctor Network. I don't know if that's the cool place that people go these days, but I definitely like looked at what recommendations people had there, but definitely don't psych yourself out. You'll always have those people who are like, I'm perfect at life and I get perfect scores on everything and I'm wonderful and fabulous. And they don't, you know, if those people get into med school, which is an if, because there's more than just a MCAT score that gets you into med school, who knows if they're successful in med school. You know, the MCAT is a test that you take just to do on the MCAT and you move on with your life. So it doesn't define you, and you could totally rise above any MCAT score, but it's important to put yourself in the best position to do as well as possible, because I don't know what the average is. Well, like when I was applying, the average, like to get into med school, they said you wanted like a 30, and just try to like take practice tests and get yourself up to snuff to try to be as close to 30 or whatever the 30 is now as possible, if beyond that, if possible, because you don't want it to hold you back. Advice for pre-med. So try to maintain a work-life balance. I know that's much easier said than done, but med schools can tell when you're like unidimensional, I think. Like they don't want someone unidimensional. They want someone who's much more well-rounded. And just to give you some background on me, I applied to med school twice. I applied right as I guess, so in my third year of college, I like sent out the application that summer. So then I guess like the application cycle was that year. And then I was waitlisted. And I never got off the wait list. And I only applied MD, by the way. I didn't apply DO. Not that there's anything wrong with that. It's just, it's really hard to find DO schools that have affiliated residency programs. There's much fewer affiliated dermatology residency programs, I should say. And I really knew I wanted to do dermatology. So that was my thing, but things have changed now because the match has fused and whatnot. So it's a totally different ballgame. But with that being said, I didn't get in the first time. My MCAT score was low. So what I did was I retook the MCAT so I took a gap year after I graduated from college, took the MCAT in that year, studied really hard, did well on it, or like, as I said, all you need is like the equivalent of a 30 or whatever. Did well enough, and I then reapplied, and I was an EMT in that time as well. So it's okay to not get in the first time. I didn't get in the first time, and I still managed to get into dermatology, which is the hardest residency ever to match in. So don't let yourself get down on the fact that you didn't get into med school the first application round. You could definitely get in the second time. I know people who got in on the third time. Never discount yourself. Don't discount how far you've come. You've worked really hard to get to where you are. Just being pre-med is really rough. So you could do it if you strategize well, if you make good choices, you could definitely make it happen for yourself. Okay, so now's your turn. I'm happy to answer all questions, any questions. I coach people all the time. I definitely coach people applying to dermatology residency. I've coached people who are now applying to med school. So whatever I can do to help you guys, I know the struggle is very real.
Yuna has a question. So she's like saying like, what did you talk about with your teachers during the office hours that kind of like enhanced your relationship with them?
It's so funny because honestly, we kind of start shooting the breeze. I don't even know. We just start talking about things that weren't even necessarily I remember my Gen Chem professor. We finished we'd go through. I'd have specific questions. I practiced from the book, and I didn't really have at the time. Maybe you guys have these now, but they didn't have an answer key that broke down the formulas or anything on how to solve the problem. It just gave you the answer. So then I'd have him go through with me the things I didn't know well, and then after that, I think we just started. It just kind of happened organically, honestly, where we just started talking about different things. Maybe he commented on my shoes or something. I don't even know, something super random. And then we just started talking about different things, and he was telling me about books he was reading that were super interesting. And I was telling him about books I had read that were really interesting, that were totally unrelated, like historical fiction or something like that, nothing, not even science, but we kind of built that rapport, and it kind of just happened naturally, kind of like the way where you meet people, you just kind of start talking about things and you find some commonalities. And it's not you necessarily go into when you meet a new person, you go into the conversation oh, I'm going to ask about X, Y, and Z and bring the X, Y, and Z up. It kind of just happens on its own. And if you look at your professors and don't feel super intimidated, they're people too. And obviously if they're your professor, they probably like teaching on some level, or at least their research. Hopefully they like teaching on some level. So, just connect with them person to person.
So as you mentioned, you're a traditional route to medical school. So I think Sam wants to know what are some good ways to stand out as a non-traditional applicant?
Yeah, I mean, I think having something to show for the time you were in med school. So if you literally have let's say a 2-year gap on your resume, every application they ask, what did you do in this time? They don't want you to be well, I was sitting on my couch watching TV all day. Hello, I caught up on Netflix. No, that's not what they want to see. They want to see that you used your time really wisely. So I was an EMT. I did a mission trip to Thailand where I learned about human trafficking. I did different volunteer kind of stuff. So I would say just try to do as much that makes you a more well-rounded person. And I didn't do the thing to Thailand for medical school. I did it because it was something I was passionate about. Coming from a public health major, I learned a lot about health disparities in different countries, and it was something I wanted to have firsthand exposure to. So I went and I looked for opportunities to do that, and that's how I found the Thailand trip. So I think just showing you're engaged in the community, you're engaged in bettering yourself and becoming more clinically prepared by doing like scribing or being an EMT or being a medical assistant, any of those kind of things, some sort of tech, that's all good.
I think like what are like some of the pressing issues like that you see in the field of dermatology that you want kind of like as a physician, like how it affects your role?
I definitely think the most frustrating thing is usually insurance companies, because what ends up happening is the insurance company dictates your treatment. They dictate the amount of time you could spend with the patients, inevitably, because they determine how much money you get as reimbursement for every patient you see. So inevitably, pretty much and this is all physicians, this isn't limited to dermatology, we're just like kind of controlled by insurance companies. But a lot of times the insurance company isn't even a physician saying, oh, we don't want you giving this medication, we want you giving a different medication. But we're prescribing when we give a prescription, we're giving what we think is truly best for that patient. But the insurance company is saying, no, it doesn't matter what's best for the patient, it matters what is cheapest for us. And I think us trying to look out for the patient's benefit as opposed to the insurance company looking out for their own pockets is what makes it really challenging.
Thank you. Also, Yuna is kind of like wondering like, is applying to medical school like same as applying to college in your experience, or how was
So to be honest, I actually got a letter in the mail before I even applied to college telling me I got the scholarship to the college I did. So I didn't even really do a real application. I'm like probably the least college application experienced person ever. I don't even know if I had to write an essay. I honestly don't remember. I might not have. I don't know. So I would say it's very different, just based on my personal experience at least, because medical school applications, it's one large application that goes out to every medical school, and in that you include all your educational experiences, your volunteer experiences, your research experiences. They have a copy of your grades and your MCAT and your like cumulative science GPA, cumulative non-science GPA, or like overall GPA, whatever it is. But with and then on top of that, every school you apply to, I can say maybe let's give it like, when I did apply, I'd say, let's say about 60 to 70% of the schools I applied to made me do another set of essays on top of what I already submitted as part of my personal statement. So you also they'll make you write essays, like things. I think a lot of the common things they ask, like how would you contribute to like diversity in our school? How would you why our school? Tell me about an ethical dilemma you overcame. So they'll have all these different scenarios that they want you to answer, and it's specific to that school. So I would say it's a lot more work. I would say like have a Google spreadsheet of every college, of every med school you apply to. Know if you provide, so all those extra essays are called secondary applications. So once you have your primary application in, like have a list of all the secondary applications and make sure, like just dot your T's and check your eye. What is it? Cross your T's, dot your I's. Just make sure you've gotten it all in, because it's very easy to like miss one and then not even have them see your application as completed, and then you just paid all this money for an application that didn't even get transmitted.
And I think this one's more specific towards like what kind of like activities or extracurricular activities that you did during high school, if you can remember them.
What did I do during high school? Man, high school, that's so far away, dude. Whoever you are. High school. So I was an artist. I could tell you that. I was an artist throughout high school, and I was an artist in college. And I actually had my art on display in in some of the hospitals I worked in. Like the hospital I did the research at, they actually had a physicians in the art exhibition, and I submitted my art to be on exhibit every year. So my art was on exhibit like throughout high school, throughout college. So that was something that was like one of my personal outlets. I want to say I did mock trial. but like I vaguely remember it. It's so crazy. I know you probably like,
Yeah.
how could you not remember this so well? But I'm telling you, have so many experiences between high school and residency that like everything becomes a blur. What else did I do in high school? I definitely had a lot of volunteer work. I volunteered at the hospital. I think I might have done like volunteer work in like old like senior living facilities, that kind of stuff. Um, I know it's hard. It's like if you're applying to call around it and stuff. I can tell you, since it's a little more recent for me, my sister, so she actually applied to dental school, but I actually had her in her high school. I helped her create a pre-med club in her high school. And that was super cool because as I mentioned, there's no one who became a physician since me in that high school. And she went to the same high school I did. So it was cool because, you had a lot of people who might not have wanted to do medicine, but they might have been interested in PA or NP, different things. So she definitely had buy-in among the students, and she would ask she would call doctors and ask if they would come in to speak to the students and stuff. And I think that was super cool that she started that in her high school. I think that was a good thing on her resume. Trying to think what else my sister did in high school, because my sister got accepted into medicals, like into a BSMD program from high school. So that's why I'm using her as a reference, but I convinced her not to do medicine. Sorry. Convinced her to go into dentistry instead. But I'm trying to think what else I had her do. Well, I don't want to take too much time on it. So if it comes to me, I'll try to remember.
And I guess so all those activities that you did in high school, did medical school kind of emphasize those activities and grades, or rather it was more like college experience and more like college
They don't
grades?
care about high school by the time you're getting to med school.
Mm.
I'd say the only time that they would care about something in high school, if it's something like kind of how I mentioned that my art was on display throughout high school and throughout college. So it was a consistent pattern for several years. So in that case, then it's worth emphasizing. Or if you're an athlete and you were an athlete throughout high school and then an athlete throughout college, and it's a linear kind of progression, then that's worth mentioning. Or if you volunteered throughout high school at a specific organization and then you continue to volunteer throughout college in that organization. So those are all really good things. So then it's a linear progression. But if it's just something you did in isolation in high school, college doesn't, med school doesn't care about that. They only care about what you did in college at that point.
And so since you said you applied twice, did you apply at the same medical school that you wanted to get during your first try, or you kind of redraw your application and then just kind of chose different schools, I guess?
So pretty much what it was is I was waitlisted and I just didn't get off the wait list. So it was dead, and that was what it was. So then when I reapplied, totally new cycle, brand new everything. So when I applied to med school, I applied to a lot. There was this book at the time, and I don't know if such a book exists or the stats are online, but it pretty much said for every medical school what the average stats are in terms of GPA, MCAT, and how many out-of-state applicants they take. And I literally went through that entire book. And if my MCAT was in range, if my GPA was in range, although, I thankfully I had a good GPA, so that helped. If they took a decent number of out of state, I just applied. So I probably applied to over 100 med schools, and I applied both DO and MD the second time because I was this is medicine is my path, and I'm doing whatever it takes to get there.
As a resident in such a competitive field, I guess what are some of the things that you kind of do to release the stream, besides just studying and just being so much focused on the field?
Yeah, no, totally. I will tell you, my intern year was the hardest year of training of my life because you're working 80 hours a week. So the only thing I had time to do in my intern year, I mean, I managed to plan a wedding in intern year, which I think was an accomplishment, which if you guys don't know at this point, you'll see at some point maybe. And I managed to work out, and I started doing bar classes, and that was like, those were my only two outlets other than like spending time with my husband, you know? So like, I really valued exercise, and I wasn't a big workout like exerciser until that point, but then I continued it throughout derm residency. I try to work out like 2 to 3 times a week. It definitely like focus, like gets you in focus. You're in the zone. You feel super accomplished. Like if you do it in the beginning of the day, like on a weekend, then you're like, okay, I have the rest of my day ahead of me, and I could study, and I could do this errand and that errand, and you just feel like super in the zone. So I'd say like my biggest outlet is probably working out. Other things I do, I guess for fun kind of thing, I listen to like different podcasts, or I'll listen to historical fiction novels as I drive. And like honestly, I do spend time with my husband. I think spending time with family or friends is like super important, because it just keeps you grounded, and it's your support system, and you should never lose sight of that. That's like your core support. So you definitely want to spend time with them. Yeah, I wish I could tell you I'm doing like 800 different things, but between COVID and between like all my responsibilities for residency, it just doesn't seem to happen that way.
I think like that's right amount of things that you should be doing.
Yeah.
Okay. And I think we'll just do like one last questions. So kind of this is kind of like a funny, but like how much sunscreen should you wear in a day to protect yourself from, I guess, infrared and other stuff?
Yeah. So in terms of sunscreen, it depends on what's exposed, obviously. So I'm actually a big believer in like, wearing rash guards, and wearing like, I literally will go to the beach and like long sleeves, long pants, like the less you have exposed, the better off you are. But like, if you just have like thin knit cottons, like those could still transmit UV rays. But if you're wearing like a thick piece of material, like if you're wearing jeans, nothing's getting through that. You know what I mean? So I'll tell you what I do every day. I put on a mineral sunscreen on my face. I try to bring it down to my neck. I'm not as great about remembering my ears, but definitely if you're short haired, or if you're male and short haired, I would encourage you to remember your ears, because I have cut out so many cancers from ears by now. It's very common to get cancers on the ears in short haired people, especially men. And in terms of how much, so they usually say you want about a shot glass worth for each body surface area you're covering. I mean, I think I just put enough, but I feel like that's kind of hard to really quantify when you're like actually doing it. So when I'm like putting on sunscreen in the morning, I just put enough that like I see like a full thick coating on all of my face and neck. So that's what you want to do. You just want to be able to see like that you've coated it, like put a thick coating before you rub it in.
Perfect. Awesome. So I think I would definitely like to end our session here. But before you go, would you like to put some kind of contact information? So maybe like if students are interested in contacting you
Honestly,
through
I
social.
think Instagram's great. I have people who randomly reach out on my Instagram to me and DM me all the time. So I'm always happy to like give individual advice. I might not respond right away, but I'll respond as soon as I can. I'm really big with voice noting back, so don't be alarmed if you see a voice note from me. And yeah, totally, you could DM me. I'm happy to help, happy to give whatever advice I can. I've had people applying to derm DM me. I've had people applying to med school DM me. So don't be shy. And I think I gave you my Instagram next. So here. So it's Heather Kornmehl. I know I have such a hard name. I didn't change my name when I got married, even though my husband has a much easier name, because my last name right now is very distinctive. And if you Google me, there's no one else in the world with my name. So I just kept it. But I'm sorry. I know it is kind of hard. I think that the pre-med eShadowing kind of posted me also. So you could probably like find me through them as well.
Perfect. Awesome. Thank you, Dr. Kornmehl, again for such an informative and inspiring presentation. I think everyone learned a lot about dermatology and hopefully go into this amazing field. So by saying that, I think I would like to end our session. Also for the participant, also don't forget to take your assessment by completing the Google form link that's posted in the chat. Remember, you have to get 70% in order to get the hours for the session, and also use just one email in order to do the assessment. Next, tomorrow we would have Dr. Stephen Frankberg, who is an anesthesiology. So we'll be seeing him tomorrow. Thank you everyone for joining us and making this a success. Thank you, doctor.
My pleasure. Have
Bye.
a good one.
Thank you.